Welcome to the Grow Your Practice podcast. Hi, I'm your host, Chad Madden, owner of Madden Physical Therapy and Breakthrough. Join me each week as we dive into the best practices, systems, principles, tips, and tricks to help you grow your private practice. Hey everybody, Chad Madden here with the Grow Your Practice podcast, and today we bring you another episode with two very special guests. First, we have Dr. Kimberlee Sullivan, who is the head of clinical care with Origin. So welcome to the podcast here, Kimberlee.
Thank you, Chad. I appreciate it.
And then we also have Carine Carmy, who is the CEO and co-founder here of Origin as well. Welcome to the podcast, Carine.
Thank you, Chad. Excited to be here.
Great. So the way that we always start on the podcast, I love to hear about how you got started in physical therapy and what made you want to get involved. And I think it's very important for our listeners to understand we have two unique roles here, and I kind of feel like this is a similar relationship as to what I have with Carl. We have somebody who is amazing in technology and implementation, and that is you, Carine. So how did you get interested in bringing your skill set to physical therapy?
Yes, I have so much respect for physical therapy and physical therapists, and unfortunately did not get exposed to the industry until far too late in life. I was a patient for nearly a decade, really struggling with pelvic pain, and I had never been referred to pelvic floor therapy. And about 10 years into my journey, I finally learned about this field on the advice of one of my now co-founders. And I walked into a clinic in LA. It was one of the only outpatient pelvic floor clinics really in the Southern California market. And after 10 years of really not knowing what was going on, seeing so many doctors, they did a biopsy of my vulva, which was insane. I walked in and they're like, oh yeah, there's a name for what's going on. We see this all the time. And in 2 months, I was healed. And so I had been working in healthcare and technology my whole career. I'd been in the startup world and have helped launch and scale multiple venture-backed businesses. And my co-founders and I just were looking at this saying, this is the most obvious need that women have in the United States. 1 in 3 women experience pelvic floor dysfunction. It's probably more than that because of, the lack of research. And yet it's so hard to get expert care, especially covered by insurance. And so we plunged into the deep end and partnered with that local clinical team. And that brought me to Kimberlee several years later. But I've been both so passionate about the space and very humbled by, how important, but also how challenging it is to, continue to do good work in this field.
Love it. Very inspiring. And I've heard many similar stories that once you go through it yourself, and you find your passion. And
exactly.
Yeah. Kimberlee, same question for you. How did you end up as a physical therapist and ultimately specializing in pelvic health?
Yeah, so my dad was a college football coach. So I grew up with being around athletes, injuries all the time. And they were always hanging out at our house. So I always thought I wanted to grow up and make sure that I took care of all these athletes. So I went to college and majored in sports medicine, but then I realized that if I was going to become an athletic director or an athletic trainer, I'd have to be there in the morning or I'd have to be there late at night. And I wanted to make sure that I had a family. So I decided to go to physical therapy school. And in physical therapy school, I thought I was going to work mostly in orthopedics. But then during one of my rotations, I got the opportunity to flip a coin that tells you how long ago I went to school. And I got the lucky choice of doing a women's health rotation. Didn't know much about women's health at that time, thought it was all just people who were pregnant, but then found it was a much bigger world of so many people who were underserved and so many different diagnoses that I had never been exposed to in physical therapy school. And I instantly fell in love with the complexity of it. And I also fell in love with the quiet wins because there's so many people who are suffering in silence and they feel like they don't have an answer. And to be able to celebrate having the first time somebody had intercourse or somebody who didn't leak when they went to a sporting event really it just filled my heart. And that's dedicated my whole entire career, all 24 years, to women's health, pelvic health, physical therapy.
That's great. And for you both, either person can answer this. How did Origin start? What was the genesis of that? And I resisted saying the origin story, but yeah.
Intentional. I can answer that, and then we can even talk about how Kimberlee and I started working together as well. But we ended up actually partnering with that local clinic in Los Angeles that I was mentioning before. The practice owner was moving out of the country, and they weren't sure what was going to happen to that specific location. And it was really one of the only places you can get in-network outpatient care in Southern California. And so my co-founders and I partnered with that local clinical team, and we decided to go into business together and really start what is now Origin. And being young, crazy pre-pandemic, we said, let's make this as big as possible, as quickly as possible, and get this to folks all over the country. And so we had big visions, and we ended up actually bringing on a couple of really aligned impact investors who could help us think about, how do we grow this to really meet the need, but I think to also get to a level of scale that we can show insurance companies this is something that really needs to be covered. It needs to be part of the standard of care, and get to a level of scale where it becomes so obvious that patients are requesting it, doctors are referring it at scale, and it wasn't in the shadows anymore.
Great. The next thing that I want to ask you about is the marketplace. So specifically pelvic health. Before we hopped on here, I had shared, 10 years ago when I was doing my rotations, going to the health fair or the job fairs, career fairs at the local DPT universities and colleges, we couldn't find anybody that wanted to do pelvic health. And today, it's much more common. And in terms of DPTs that are entering the workforce that want to do pelvic health. And I know one of our frustrations with that was, I was in the research and we had a retiring pelvic health therapist who I think did it for 37 years. She was amazing, Marianne Gingrich. And when we started looking into the research for marketing purposes to physicians, the one thing that came up was 50% of women at this, new moms at this 6 week postnatal checkup appointment, experience back pain. And at least in our area, most doctors were just saying, OBGYN doctors were just saying, oh, that's normal. That happens all the time. But they weren't giving any sort of recommendation or here's what to do. What's some of what are you seeing in the marketplace right now, research in terms of landscape? Like, what does that look like for pelvic health? I know you both have alluded to this, but how prevalent is the need within the marketplace?
Well, I would say it's very much in the need. I always think of like as a physical therapist, we are very accustomed to people getting, if they were getting a total knee surgery, they'd have pre-therapy and then they would have post-therapy, right? We're very accustomed to that. We know that it's like 2 times a week or 3 times a week. We know all of that. But for women, we go in and we have this large thing pass through a small space, and it leads to a lot of complications. There's trauma. There's so much to it. And we at 8 weeks say, it's normal, keep going, you'll be fine. And we know that that is not true. We know that 50% of women will have a pelvic floor dysfunction in their lifetime. I think it's actually greater than that. It can show up in continence later. It can show up in pain and with intimacy. It can be pain with sitting at work. There's so many different things to that. And I think that it's just not reported and looked at as much as it needs to be, because we have assumed for so many years that this is acceptable and this is just common for a woman to go through.
Yeah. And if I could just add something to that. Oh, go ahead, Chad. Sorry.
I was just going to ask, why is the population so underserved? But go ahead, Carine. Sorry.
Well, I just want to make a note. We launched our business in 2020. We were working on it for a few years beforehand, but kind of publicly. And at the time, we had about 50 to 100 doctors in Los Angeles referring to that local clinic. Today, we have about 10,000 doctors referring to Origin around the country. That speaks obviously to the quality that we provide, but I think the awareness has shifted so much, first among women. Like in the pandemic, people were going on social and they started talking about really intimate issues for the first time, and not just in pelvic health, but about mental health and postpartum depression and all of these topics. And I think the inbound to medical professionals, now even with influencers and ChatGPT, has kind of forced the issue. But the blockers are still, access. There are still too few providers who, are trained and have that expertise, even though that's growing. And then, the majority of the market is still out of network. And we hear a lot from our referring doctors, like they're so happy that we take insurance because they can't refer to cash pay practices for the majority of their patients. And it's really, really hard, as you know, for an independent pelvic floor PT to take insurance. The model is not designed for this industry. And so I think until that fundamentally changes, we're going to still not be able to serve the need that exists.
Yeah, that's a pretty solid point, Carine. Just only because when we looked at our numbers, and we are insurance based, we do both. We're a hybrid clinic. It is brutal to do the one-on-one 1 hour plus appointment. And accept what the insurance gives. It is a break even at best. It is most commonly a loss. So any insight, any hope that we have in the country, we're getting that to change anytime soon.
I think we are inching towards that. Our approach has been to really start to demonstrate clinical outcomes at scale and the cost savings at scale, and work really closely with insurance companies to show this is not orthopedic general PT. We're not using PTA. It's one-on-one visit model. And I mean, imagine if you don't go to physical therapy. In my case, I saw 6 different OB-GYNs. I had a biopsy. I had like 1,000 creams that I was prescribed. We probably spent, $5,000 to $10,000 on my journey versus a small episode of PT. And so it's both I think a quality and a financial conversation with insurance companies. The long game, though, I think, is we need specialized CPT codes. We are just starting to figure out, how to advocate for that. And if anyone's listening on this call and wants to, help, please reach out to us, because it's going to take, the entire industry to be behind that.
Yeah, I don't hear it talked about often, but APTQI, APTA, UPTA, all 3 will be represented in Nashville, and we can make a connection there.
Thank you.
For advocacy. Great. So I want to talk about the white paper that you put together and have recently published. And I mean, at least as far as I'm aware, it's the largest outcome study that I've seen for in-person pelvic floor PT. Walk us through what you set out to do there, and ultimately what you found in the end through that research.
Yeah. Kimberlee, do you want to speak to that, or do you want me to answer that?
Go ahead and start, and then I will support you.
I think, for us, we have treated tens of thousands of patients in this set of conditions under pelvic floor dysfunction and really women's musculoskeletal health. And to your point, Chad, like there's not enough research. And so we are really trying to help advance the industry and show this care works, it's clinically effective. But one of the very specific questions we were trying to answer is, how does virtual care work? We started doing virtual care, telehealth for pelvic floor therapy in the pandemic. And everyone's like, how is that going to work? I mean, it's so perceived to be so manual. And anecdotally over the years, we've just seen incredible outcomes for our patients. And again, and these are patients who never come into a clinic and some who work with us in a hybrid model. And so we did a retrospective analysis of about 5,000 patients, just under, to see what are the outcomes across these different populations and, how effective is virtual care. And what we found was actually, very essentially clinically equivalent care across a number of diagnoses for virtual versus in-person, which I think was, a pretty big seismic shock for the industry, because I think there's such a perception that it needs to be hands-on. We're obviously a believer in both, and that's why we have clinics and we have virtual care, and we're trying to meet patients where they are, but really excited to be able to demonstrate that and hopefully get patients more access.
And I think that one of the reasons why I joined Origin is because of access of care. We know that women do not have access to this type of care. There's not enough providers out there to meet the demand of that's out there. There's women who are in rural areas. There's women that can't come because they're in, taking care of their families. So really being able to look at the virtual piece and the hybrid piece and the in-clinic piece is so important for us because we are fighting for their access of care. And this white paper proves that with our delivery of virtual care, that we can actually get them better too, not just in clinic. And so I think that's really important as a physical therapist who has fought for 24 years for access to care, and all the physical therapists that are listening on this call, like that's why we got into our professions, to help people, but it doesn't always have to look the exact way that we might think that it needs to be delivered. And so I think that that's one of the most powerful pieces of our white paper.
Nice. Kimberlee, from a clinical perspective, what surprised you the most about working in like a virtual or a hybrid setting versus that traditional clinic, just like you were talking about right now? What were some of like maybe the early pitfalls or expectations that you had to overcome, other than what you just mentioned right now?
For sure. I mean, I was taught to be a manual therapist. And so I think that like when you think of physical therapy, just like patients do and physical therapists do, we think of our hands and being with that person. But I think that we all do the best with education. I mean, when a patient is heard and seen through education, acknowledging their diagnosis, teaching them how to help themselves, I think that was a big open for me. It's like, wow, these patients need so much help, and how we can deliver that in a very educational and a safe space, they actually get better. I think the other blocker that I didn't realize how much we were going to have is referrals. Like our referring physicians do not see physical therapy always in a virtual setting. They see that as that they want also hands-on. And having that conversation with referring physicians that actually our patients are getting better, sometimes sooner than they were in person, that it has opened their eyes too. And so I think that actually has been one of the things that I was most shocked about, is that they wanted a specific delivery of care, but we could actually get them better with virtual too.
Cool. Follow up to that. And I'm going to hit you with a zinger here.
Okay.
First virtual patient I ever treated was in 2013 via Skype.
Amazing.
International, in Calcutta, India. It was like 8,000 miles away, had no access to care, was very wealthy, and had found me through a YouTube video that I had posted, and I ended up treating him. And I remember like trying to problem solve virtually because, yes. He even hired, it was like a masseuse or maybe a personal trainer. Mm-hmm. And I was trying to walk the person through like doing manual therapy techniques. And what I had to learn how to do was actually do instruction and demonstration where they could self-mobilize.
Yes.
And it had an amazing outcome, had an MRI on the back end, showed 3-level herniated disc healing, all this other stuff. What has surprised you the most about what you've been able to do virtually that like 5-10 years ago, you were like, there's no way I could do this. And so like, I'm really looking for like the problem solving that you're working through there.
Well, I have to sit on my hands because my hands want to go straight into like through the screen, but I want to sit on my hands and be like, this is how, I mean, it's challenging your brain to be able to do what your hands has been doing for 20 years. You know, that's a very difficult thing. But I think like the biggest success is always the patient realizing all the stuff that they can do for themselves. Somebody who has had a history of pelvic pain and inability to have penetration, and helping them with breathing exercises, helping them with relaxation exercises, dilator care, and then them achieving it, like giving them a high five through the screen. Like, as hard as that is, I also am super proud that our team is able to do that and that we're able to help somebody who would not have been able to do that before.
I think too, just from a patient standpoint, I take for granted, because all we do is talk about pelvic health. We have a saying at our company, there's no such thing as TMI. So I'm like, I'm talking about sex, I'm talking about incontinence, like we're really open. But a lot of people find this care really scary and uncomfortable. And, when 1 in 4 women have a history of trauma or sexual abuse, the idea of even going to an OB-GYN office can be terrifying, let alone this other type of therapy. And so interestingly, one of the populations we've seen the best outcomes for has been the pelvic pain, painful sex population, who, I think you would expect need that in person. And so it's been very impactful to see, okay, for people who are just never going to actually walk in the door, what can this do for them?
Yeah. But on those lines, I pulled out a quote from one of your clinicians, and they said, removing the clinical environment actually reduces the threat load significantly for this population. And like you've both already mentioned, some people, they want to be in a live clinic. Some are comfortable with the hybrid setting, and some don't want to leave the house for this reason. The rest of that quote was, I found patients progress faster because they're practicing in the exact space where they need to feel safe. Anything else that you want to expand on there with what you're seeing with your patients that you're helping?
Well, I think that a lot of patients, what Carine was saying is they don't want another pelvic exam, right? They also don't want to go to their 7th or 8th provider and not know what is going on. So it's a very safe environment. A lot of us have focused a lot of our careers on being trauma informed. And so understanding the power of somebody being in their own environment, helping themselves and them gaining their own ownership in their bodies is super powerful. And that's something that we can definitely help with in clinic, but having them do it in their space that they feel safe it's very powerful.
Cool. So the majority of our owners that are, the majority of our listeners right now are practice owners. Can you talk through, maybe they're already doing pelvic health or they're thinking about adding it. Maybe they're doing general ortho or vestibular care and they're wondering if they should expand. What's the opportunity that they're most likely underestimating?
So I was a practice owner for 16 years before I joined Origin. And I think,
by the way.
thank you. I'm very proud to say that. And I'm very grateful for my opportunities and also my opportunity to be a part of Origin. I think that they're underestimating the demand. I think that they think there's not enough people out there for this program to support it. And there is way more. I remember when I first started my practice, and a lot of people said there wouldn't be enough patients. And I grew to 13 PTs and had a 2 to 3 month wait list. We could not build it fast enough. And that was actually one of the reasons why I joined Origin, is because there are so many people. So I really do think that the demand piece is what is underestimated.
Anything to add to that, Carine?
I totally agree. I mean, it's always been interesting for us as we think about, do we expand in the cities we're already in or go to new markets? And we have always felt like, okay, we're probably cannibalized in Austin if we open any more. We have 4 clinics there right now. And we're like, actually, we could probably open another 2 to 3, and the same is true across the markets we're in. So I think the demand is really there. And there's a lot of providers too, who I think with the support and the learning and development and the mentorship would love that opportunity to really be able to focus on a population that maybe even just, really resonates with what they're going on in their own lives.
Yeah. I
think they're also are already treating the population. They just don't know it because their patients haven't told them or disclosed. And so that's a part piece too.
Kimberlee, I love that one. And only from personal experience, there were so many times I was treating a pelvic this, we'll call it a pelvic dysfunction patient orthopedically, and then they would reveal later, oh, by the way, I was having this problem that I didn't tell you about. Now that is gone.
Yes.
And then Marianne and I would co-treat, and she would do the pelvic health aspect. I would do the ortho. And that's I completely agree with you there. That is a huge miss for our profession right now.
I teach at a couple of the local schools for PT and PT assistant. And even if they're not interested in pelvic health, I always say you're going to treat pelvic health patients. They're there, they're all over the place, and just making sure that they're aware of all the diagnosis and all the symptoms so that if they don't want to treat them exactly, they could at least refer out.
Yeah. Next one, question I have on virtual care. So virtual care you've described as a primary modality, I think is how you had it. And so it's not a fallback or like an inferior substitute, but it's a choice that should be selected intentionally. And, that's a significant mindset shift for most owners. Even as we're having this conversation right now, I'm thinking about this, like, are we missing it? Because I think for 4 years we treated virtually and then, just eliminated that. Because we're so busy live right now. How should they be thinking? How should an owner be thinking about building a virtual offering?
I think the first thing to note is actually what you just said, Chad, which is you have to build it as an offering. It can't be just, okay, we have a telehealth visit that you do if you can't make it in, or, someone is sick today. And I think what has made our program successful is the training and the model of care. Because as Kimberlee was alluding, to do it well, it's a mindset shift. And you have to think about, how are we going to practice different scenarios? How do you set expectations? What do you do when there's no front desk supporting you at the beginning and the end, with kind of that packaging of the visit and understanding plan of care? And then how do you get the buy-in around the home exercise program? All of these things are similar, but they're different muscles. And so for us, treating it like a program, investing in it, with that training, and then figuring out, is it the same staff or is it a different staff or a combination? I think has been for us one of the biggest learnings. We started with kind of a hybrid day where people would get a day at home and be able to treat virtually. And sometimes we still do that, but operationally that became really complex, and actually training wise, it became really hard. So now we have a dedicated virtual team that is just really an expert at that, and then a dedicated in-person team, and sometimes there's crossover. So, for anyone listening, happy to, share more of the nuts and bolts. But I do think, too, patients love that optionality, and we've been able to support folks, especially, as they're going through big life moments. Like, we can treat virtually 2 weeks postpartum, right? Like, you're not able to get that kind of care, and you're actually probably often doing some life-saving interventions. We've heard about that from many of our providers, like, oh, we actually helped identify an indication that they should be back in the hospital or seeing their doctor ASAP. And so there's just use cases too that you just can't do in person.
Anything to add there, Kimberlee?
I was just going to say that, like, being specifically trained is really important, because I think that you reflect your training, and I would want to make sure that, like, you would lean into learning how to be able to communicate. And then also the piece that Carine talked about is, how do you get them to get their home exercise program? How do you get them to interact with their home exercise program? We have technology where we can actually look at what they're doing at home and their feedback. And that's a really important part of the process, is getting that feedback.
Nice. At Origin, you've been building homegrown AI tools to support clinical care. And can you talk a little bit about that and how you're helping your therapists be more consistent, more effective? You don't have to give away all the trade secrets or anything, but can you talk about what you're doing to accomplish that?
I'll give the high level, and then Kimberlee, I'd love to hear, from your perspective, what it's meant for our clinical team. But AI has obviously meant, like, you can build so much so quickly. We have 2 engineers on our team, which I know is more than most PT practices. But as I think about, what we're trying to achieve and the scale, it's been remarkable for us. And it's much smaller than a lot of, big kind of healthcare companies. the problem we started out with, which is a burnout problem. Like our clinicians have told us again and again, documentation takes too long. Charting, billing, all of the work around my work is just really onerous. And how do I show up in this very high emotionally demanding role every day, but then still have this list of things to do at the end of the day and sometimes take home. And so that was the problem we'd really tried to solve. And our EMR is a bit more flexible, so we can build technology on top of that. And what we ended up doing was build a Chrome extension that is now enabling us to help streamline documentation, actually do a lot of automation and really just support the clinical time. And I think, Kimberlee, the stats we're seeing now is sometimes an eval used to take 20 to 25 minutes, and now it's taking 5 minutes or less, which if you think about, what a busy day can look like, that has really added up. But I'll let you chime in, Kimberlee, too.
Yes. So as a PT, I don't think I signed up for 2 to 3 hours of documentation every night. They did not tell that to me in school or sell that to me as I was becoming a PT. And so looking at Origin, we want to make sure that our PTs are here to treat. That's what they wanted to do. That's what their dream is, to increase access of care and treat patients. And yes, we have to document for compliance, for state, for insurance. And so we know that's part of our role. But how do we get that as efficient and as effective for them as possible so that they're dedicating their time for the actual treatment? And so what Carine said, we've been working on our documentation with AI overlays to be able to help us speed that up. I was in the clinic this week, and one of the PTs was like, "This has changed my life. Like, I am not taking work home at night. I am able to do evals write-ups in 5 minutes, follow-up note in less than a minute, and then writing like reevals and discharges in less than 5. And before, it was taking an hour to 2 hours at night. And so that to me just makes me very, very proud of all the stuff that we are doing to make sure that the clinicians have an efficient day and they're focused on the things they need to be focused on.
And Chad, one thing I'll note for all the practice owners listening, sometimes it can seem really expensive to invest in this, but we actually did, do we buy a third-party solution and use that, or do we build something ourselves? We tested so many AI scribes. None of them actually worked for our setting. We tested so many documentation tools, and they were all so expensive. Like, it would actually not scale in the way that we needed to financially. And so it ended up actually being substantially, more cost effective for us to start building the tools that our team specifically needs. That might not be, the same and outside of pelvic health. And so, I would obviously always evaluate first what's out there, but it's an interesting time right now in terms of, the cost of technology.
Yeah. The one for our average listener, you have 2 more engineers than they have.
Yeah, exactly.
The other challenge that I've seen, and this is a conversation Carl and I have been having for 14 years, nearly impossible for a private practice owner with our skill set and knowledge to manage an engineer. Mm-hmm. And that is essentially the crux of the problem. So in the case of Origin, you really have the best of both worlds, where you have the clinical expertise plus the AI engineers building solutions for you. And I can see how that would work really well. It is hopefully getting cheaper as we go along, although I just increased my Claude subscription.
Exactly.
But hopefully that will continue to get better and we'll have more wider spread adoption there. Because I know the other thing that I'll share, and this has been on the podcast repeatedly as a thread line, as a through line, it is hard to hire right now. And I think when you can sit down in that opening interview and, everybody that we're interviewing, they get to follow our therapist for a period of time. If they see that AI scribe, right, and then they also have a conversation like, "Hey, are you taking notes at the home at the end of the day?" "No, I leave at 6:00 when I'm done seeing my last patient." That is a very big sales point, especially in the marketplace right now. So great for retention. Very smart on your end to be doing that. Go ahead.
I just to say thank you. And as an employee that treats and documents, I appreciate it.
Yeah. You listed some patients in your impact report, and just circling back, and I'm thinking literally of patients that I had treated that were pelvic floor, but they had suffered in silence for years before they found help, and really they're the typical pelvic health patient. There's nothing crazy about their story. What do you want other healthcare providers and practice owners to understand about what their patients are going through before they ever get referred for a pelvic floor PT?
So I would start with not being afraid to ask. I think that like Carine said, that there's no such thing as TMI. I would encourage that with all physical therapists. Is like, we have a tendency not to ask about sex. We have a tendency not to ask about bowels and bladder unless it's like something specific or like we're screening for something. And because we don't ask about it, we haven't normalized it for the patients. And so by going ahead and feeling comfortable and asking them these questions, they will open up and say, actually, I do have XYZ, or I leak when this happens, or I haven't had intercourse for 2 years. They will say that. And then if you feel worried about that answer, I would make sure that you know where you can refer to. And that will help that, so that you don't have to have all the answers. You just need to know where to go or where to refer patients.
Dream, and we're starting to think about how we can partner and advocate for this, is we just need a screener, whether that's happening in the medical intake at a clinician's office, as part of a postpartum physical recovery screener. We are, to Kimberlee, your point, we're not asking the questions. And I can't even tell you, even for us, where we talk about poop on social media, and we're trying to create a very safe, inclusive space. The amount that we have normalized just even incontinence as a culture, that someone can be in our clinic and be treated for 3 to 6 sessions before they finally start talking about that, and they're there for something else, and they're like, oh, but I also leak a little, but I know that's normal, right? And so, how do we just start to ask again and again to get folks to the care that they need sooner?
Great. I have one final question here. But before I do that, what is the best way for our listeners to learn more about Origin or to find you on social? What's the best way to contact you?
Our website is theoriginway.com, and that's our handle on everything. So on Instagram, on LinkedIn, and would love to collaborate and hear from folks.
That's great. And there's one other opportunity, which is, Kimberlee, you'll be presenting at our Titans Live event in Nashville. September 24th through the 27th. We'll have links for that as well. And by the way, all of the white paper, any other research, all of the links that you've graciously provided, we'll make sure that goes into the show notes as well. Final question: if every practice owner listening today did one thing this week to better serve pelvic health patients, even if they're in a sports clinic, right, and they only treat 15-year-old gymnasts or something extreme, and or like a running clinic or something like that, what's that one thing? What would you tell them to do?
I would say ask questions. Like, I would not be afraid to ask.
Do you have one question that you have found like people are most open? Like I'm sure you know what it is, but there's a way that you're asking that question. What is that question, Kimberlee?
I mean, usually when I'm talking to somebody, I will say, I'm a pelvic floor physical therapist, which means I treat from here to here, which you can't see the whole thing. And I say, is there anything that you would like to ask me questions about regarding your bladder, your bowel, or having intercourse?
Perfect.
That's probably the most actionable. But I think even starting with like, hey, did you know you have a pelvic floor? Might even be, level 1, because I did not know that word, right? After 10 years, I didn't even know what to Google. I think that's changing. But as a patient, just even starting to get the language to understand our bodies, like it's almost like not knowing you have a back for half your life. And so just saying, hey, do you know you have a pelvic floor? It's connected. In case things come up, might be worth looking at, especially for the gymnasts, because we see a lot of incontinence among high performance athletes. So that might be an easy place to start.
Awesome. Well, thank you both. Thank you so much for doing this, and this has been great. Kimberlee, I will see you in Nashville.
I'll see you there. Thank you so much.
Thanks, Chad.